Okay, so we start. Today we have a new module, and in the next 4 sessions we will be dealing with therapy procedures. So in the previous module we studied about drugs and how to make them into medicines. And now we are going to discuss about therapies, or how actually the treatments are implemented. So today we will be dealing with the overall logic behind choosing therapies in Ayurveda, and then we will also look into details of some commonly used therapies. So first we need to understand some theory, and so I will try to just summarize the principles on the basis of which these various therapy procedures are selected in a treatment plan. So according to Ayurveda, the body is a balance of anabolic and catabolic processes, and in fact this is something which is also the foundational principle in Western medicine. And what Ayurveda says is that the body is being constantly rebuilt through this process of anabolism and catabolism, and in disease these basic functions are going out of balance. And in some disease there is actually an exaggeration of anabolic activities, and in some diseases there is an exaggerated domination of catabolic activities. So in Ayurveda we also classify diseases into 2 broad categories: the diseases caused by excessive anabolism and the diseases caused by excessive catabolism. Of course, I guess you understand what we mean by anabolism and catabolism. Anabolism is all the constructive processes in the body, which the body builds, it grows, and catabolism refers to all the destructive and breakdown processes of the body. So the delicate balance between these 2 is what maintains health. And the principles of Ayurveda are actually derived from this understanding of metabolism. So Ayurveda also classifies treatments based on these principles. In Ayurveda we say that the physician does what the body is naturally doing. So if the body is engaged in anabolism and catabolism, then what the physician is doing is also aiming to bring balance to these processes. So all treatments in Ayurveda are broadly categorized into 2 groups called Langhana and Brimhana. So Langhana is a term which refers to catabolic activity. So when we do Langhana treatment, the body goes into the mode of catabolism. And then there is Brimhana, in which the body goes into the mode of anabolism. So then we have finally what is called as Rasayana, in which actually they both happen in a balanced manner. So we can see that treatment in Ayurveda is essentially focused on tilting the balance, or bringing back the balance of the anabolic and catabolic activities, and then putting them on the right track. So that is why all treatments in Ayurveda, all diseases will have 3 phases of treatment. First is Langhana, which will be the catabolic phase. The second is Brimhana, which is the anabolic phase of the treatment. And the third is Rasayana, in which we again bring back the balance. It is anabolism and catabolism together is called as Rasayana. Because ultimately in the body both have to happen together, and Rasayana is that treatment in which these two processes are fine-tuned to work simultaneously. So is this clear? So in Ayurveda, all treatments, irrespective of the disease, can be classified into broadly two categories: catabolic, anabolic, and then the third is a balance of the two, which is called Rasayana. So have you all heard of these terms? That is Langhana, Brimhana and Rasayana? Okay. Yes, so we have to understand that Rasayana is the balance of Langhana and Brimhana. Rasayana is the balance of Langhana and Brimhana. So now this is very important, this first point, because we are now trying to build the framework or the scheme for Ayurvedic treatments. So there is we start with Langhana, then we go to Brimhana, and then we go to Rasayana. This is the common framework for management of any disease. But the only thing is that the emphasis will be slightly different in different diseases. And in acute diseases, the whole, okay. So, especially for chronic diseases, these three stages are really very, very important. In acute conditions, we may have to do very specific interventions. But today Ayurveda is used also to treat mostly chronic illnesses. So this classification into the three categories is really very important. So now we will look at the sub-classifications of Langhana. Langhana treatments are again divided into two. One is the biocleansing procedures or Sodhana. So in this method, all the byproducts that are accumulated in the body are cleansed. The body is purged of these accumulated byproducts, and this procedure is called as Sodhana. And the second is pacificatory or stabilizing, and this method is called as Shamana. So during this phase of treatment, the corrective mechanisms of the body are activated, and the digestion and excretory processes are fine-tuned, and there are many methods of Shamana. So I'm just repeating this again: Langhana, Brimhana and Rasayana. Catabolic methods of treatment, anabolic, and then the balance. And within Langhana, you have two methods. So cleansing procedures like Pancakarma actually come under Langhana, in which there is breakdown and removal of unwanted substances from the body. And the second is called as Shamana, in which we don't do drastic cleansing, but we regulate the body's corrective mechanism. And this is mainly done by the use of substances that are digestive, fasting, exercise. All these things are things that are interventions that promote catabolic activities of the body, and without really resorting to drastic measures of cleansing like Pancakarma. So Langhana is Sodhana and Shamana. I don't know whether you have heard these terms. Okay, so these are very important fundamental terminologies used in Ayurveda, so I would recommend that you get familiarized with that. But for convenience, again, catabolic, then anabolic, and rasayana, balance. And catabolic is again divided into cleansing and pacifying, which is in other words called as Sodhana and Samana. So this is the framework, and now we come to anabolic processes. These are done after Langhana has been completed, and the goal of Brimhana is to replenish the wasted tissues and elements of the body. And this wasting happens because of the effect of treatments and also the potency of the medicines. So when you do the Langhana treatment, there is a lot of destruction, and a lot of materials in the body are burnt away or removed, and there is actually weight loss. So Langhana treatment, if it is done properly, we will have weight loss. So this can be measured actually. It is one of the ways to know whether your Langhana treatment was effective or not. Langhana will definitely lead to weight loss. So you can expect a weight loss of about 5 kgs to even up to 10 kilos after you do a process of Langhana. And the Langhana process in a disease can take a minimum of 7 days to, even if you're doing the full-fledged karma, panchakarma, it can even take up to 41 days, or even more when you do the full-fledged panchakarma. And so even the weight loss can be more depending on how intensely you do the treatments. But it's one sign of properly done Langhana. When you do Langhana, there is weight loss. Similarly, when you do Brimhana, there is weight gain. So after the Brimhana phase of treatment, which is a little longer than Langhana, Langhana cannot be continued for long because of course it will make the body very weak, and Brimhana shouldn't be done. Yes, that is part of Langhana. So you are in the process of Amapachana. And also, this can be customized. We don't need to reduce weight in every patient. So we have to have a plan as to how much weight has to be reduced in which patient and to what extent. So it's not advisable to reduce weight in everybody drastically. So these are all things which we learn as we become an expert physician. So as I said, Langhana causes weight loss and Brimhana causes weight gain. And that weight gain also needs to be balanced, because if you keep putting on weight, then it is, so we need to bring about a balance. And Rasayana is that which helps you to maintain your weight. So if you're doing a proper Rasayana, then your weight becomes stable. So this is one simple way to understand the effects of the treatments by just looking at the impact on your weight. So there's weight loss or weight gain, or weight becomes stable. Now we look at biocleansing. So one of the most drastic methods of catabolic treatment, or what we call as Langhana in Ayurveda, is biocleansing. This is otherwise called as Sodhana in Sanskrit. Sodhana means to cleanse. I want to say that this is not detoxification. Ayurveda does not talk about detoxification. We can just say that it is cleansing. So biocleansing is done to eliminate the accumulated metabolic byproducts in the body, which means that there would be change in the metabolomics of the system. And recently there has been a study which was published in a journal, Nature journal, and I will give you the title of this paper. And they have shown actually in the study that with the use of Pancakarma-like treatments, the metabolomic profiles are changing. So this is published in a Nature journal, which is a very highly reputed scientific journal. So for the first time we have an evidence to demonstrate that these methods of Langhana actually create an impact on the metabolomics of the body. And so that's what Ayurveda says when we do this, prepare the body for biocleansing. There's a lot of change in the metabolism, and before biocleansing there are methods of mobilizing. We need to precipitate the waste products. So that's the preparatory procedure for biocleansing, and we will discuss some of those procedures today. And after they are mobilized and precipitated, then they come into the alimentary tract, and from there they are removed by emesis or purgation. Emesis or vomiting, inducing therapeutic vomiting, has the ability especially to remove kapha from the system, whereas therapeutic purgation actually removes pitta from the system. And we have also, for vata, removal of vata, medicated enema. And I want to clarify here that the enema that we do in Ayurveda is not like the cleansing enema in modern medicine. In Ayurveda, what we do has a more profound therapeutic action. So really speaking, the three Sodhana treatments for vata, pitta and kapha are vasti, vireka and vamana, which means enema, purgation and vomiting or emesis. So for each of the dosha there is a method of cleansing. And then we have, for cleansing the cranial cavity, the region of the head. There's another procedure which is called as nasya. Nasya means applying medicines into the nasal cavity, and this precipitates a lot of waste from. Yes, so we have the five methods of cleansing. Please understand that this is not Pancakarma. Pancakarma is different, and I will tell you the difference. The five methods of cleansing are emesis or vomiting, purgation, enema, nasal purge, and bloodletting. So here, bloodletting is an independent procedure. They cannot be done along with the other four, because if you do bloodletting along with the other four, then the person will collapse, because there will be a lot of body fluids will be lost by emesis purgation and enema, and if you also do bloodletting, in such a person, then there will be critical, what you call as hypovolemic shock. So it can lead to a, okay. So if you do bloodletting also along with the other panchakarmas, then it can cause even death of the person. So bloodletting cannot be included in panchakarma. It has to be done independently. But it is one of the 5 methods of biocleansing. Is this clear? Okay. So now we move on to the other treatment procedures. And here we look at pacificatory treatments, which are otherwise called as Samana in Ayurveda. And the Samana treatments, the aim of the Samana treatments is to stimulate and normalize digestion and thereby to balance the body elements. So the methods are digestive stimulants, these are called as Dipana, then digestives. So there are medicines in Ayurveda which can activate the digestive and metabolic systems and correct them without having to do drastic cleansing procedures. Then the other methods of pacificatory treatment are fasting without food and water, then exercises, then exposure to the sun and exposure to the wind. So these are some of the methods of pacificatory treatment which are different from the biocleansing procedures. But the net effect of all these interventions are that the digestion will improve. So when you have done proper Langhana treatment, how do we know that we did proper Langhana treatment? We know that when there is elimination of waste, we can see the change, and we know this by change in the metabolomics. Yes, even before weight loss, there is also increase in digestive capacity. So first you will see the cold chemistry of the blood changes, the metabolomics changes. Then there is increase in digestive capacity, and then of course there is weight loss. So when all these things happen, we can be sure that we did proper Langhana treatment. And this can be done with or without Panchakarma, with or without biocleansing. So this is about this method of treatment, and then we go on to Panchakarma. So Panchakarma is a treatment program and is not to be confused with the 5 methods of biocleansing. Actually, bloodletting is not included in Panchakarma. Panchakarma consists of emesis, purgation, nasal purge, and then 2 types of enema. So that's the thing, instead of bloodletting, there are 2 types of enema in Panchakarma, with decoction and with oil. Is this clear? Okay. So if we say we are doing Panchakarma, then we should do all the 5 procedures. If we do only one or few of them, then we should only call this as Sodhana. So this is very important. It's just biocleansing and not Panchakarma. So Panchakarma means all the 5 procedures done together in sequence in a patient. When only 1 or 2 of them or few of them are done, then we simply call this as Sodhana. So this is the difference. So there are 5 methods of cleansing, and this includes bloodletting, but Panchakarma does not include bloodletting. And actually Panchakarma ends with oil enema to prevent the imbalance of Vata. Because when the body is cleansed, there is a chance of Vata increasing, because all the Kapha is lost from the body. So Vata will increase, and that is why Panchakarma ends with oil enema, which is very specific and very effective in balancing Vata. So is this clear? Okay, so this is the difference between Panchakarma and Sodhana and Panchashodhana, which means 5 methods of biocleansing, then the Panchakarma program, and simply biocleansing. These are slightly different. Now, if you were to do Panchakarma, then this has to be done following a very strict protocol. And we're really concerned that people, a lot of people today are doing Panchakarma without adequate preparation. And it has become a fashion, a fad, to say that we are doing Panchakarma. Panchakarma cannot be done unless the physician is really very well trained and has got vast experience in, treating many diseases. So the average practitioner cannot really practice Panchakarma. And Panchakarma is not just the simple 5 procedures. They have to be done in a very sequenced manner, and then there are a lot of preparatory procedures which we have to do before implementing Panchakarma, and then we have to follow up the patient after Panchakarma. So even a mini Panchakarma program would take at least a month or maybe a month and a half, and so it's really unacceptable to see what is being done today, Panchakarma being promoted as a 3-day program Panchakarma or 6-day Panchakarma, 7-day Panchakarma doesn't make sense. Panchakarma, minimum you will need a month, and that too is a very, very reduced version of Panchakarma. So this is all to know, the sequence of the procedures, which is to be done first, which is to be done last. And there's also a gap between 2 procedures, because if you do Vamana or vomiting, then the body needs some time to recover before you can do purgation. So if you immediately do purgation after vomiting, then this can lead to severe unwanted complications and problems. So in Ayurveda, we have very clearly identified how many days gap should be there between 2 procedures. So if you were to do Vamana and then if you were to do Virechana. So like that, for all the procedures, the sequence is important, and the time gap between the actual execution of these procedures, both are really very, very important. So today we are basically going to look into the details of 4 or 5 preparatory procedures. So in our coming webinars, we will also go into the details of the Panchakarma and then the post-Panchakarma regimes. But today we are going to look at the preparatory procedures. And the preparatory procedures for Panchakarma can be broadly classified into 2. Oleation, or the process of oiling the body from both inside and the outside. So oleation is a process in which the body is saturated with fats, both internal administration as well as external application. And after oleation has been done satisfactorily, then the patients are subjected to another procedure called fermentation. So in the fermentation process, the body is exposed to treatment procedures which will induce sweating. So there will be intense sweating. And actually these preparatory procedures, without these preparatory procedures, Panchakarma will have no therapeutic effect. Because in Ayurveda, when we say Vamana or Virechana or MS vomiting or purgation, it's not simply cleaning the stomach. In the first step, we have to mobilize all the wastes and bring them into the alimentary tract. So that is the key procedure. That's the most important aspect. And if you don't bring all the wastes into the alimentary tract, then doing Panchakarma has no benefits. So the preparatory procedures are actually determining whether your Panchakarma program is effective or not. If you do not prepare the patient adequately, then Panchakarma may be of not much use. Even if the patient has good purgation, the patient has vomited well, but there's no impact on the disease. This can also happen if your assessment and your preparation is not appropriate. So after the preparation is done, we need to understand why the preparation is important. I hope you remember that we discussed during a previous webinar that the body is divided into 3 zones: the Marma, the Sakha and the Koshta, which means the zone of the vital organs, the zone of the vessels and body channels and elements, and then the Koshta or the alimentary tracts. So in Ayurvedic treatment, the first challenge is to bring all the accumulated wastes from the vital organs to the intermediary passage, and from there into the alimentary tract, from which place they can easily be removed from the system. Actually, in Ayurveda, oil itself increases body heat and induces sweating. So the oil itself, because the oil works like a film, the oil blocks the channels and the micropores of the body, and thereby the oil traps the heat inside the body. So when you apply oil, what happens is that your body loses the ability to lose heat. Body is not able to lose heat anymore because the oil becomes a film on the skin and it closes all the porous openings. So the heat is trapped inside. And when the heat is trapped inside, sweating is induced. So in fact, if you ask what is the time the oil has to remain on the body, It is the time taken to actually sweat, the time taken for the body to become heated and sweat. That is a period for the duration for keeping the oil. Now, if you ask the question why Ayurveda does heating, and also another thing is that oil itself is heated. We never apply cold oil. So oil is heated, and the applied oil traps the heat inside the body. So all these things are sufficient to induce sweating and facilitate the proper absorption of oil. And another thing is that the purpose in Ayurveda is not just to absorb the oil. The purpose in Ayurveda is to precipitate the wastes and bring them to the alimentary tract. And it is found by Ayurveda that if you apply the oil first and then do the heating or fermentation, then it becomes more effective for all the wastes to come into the stomach. So the wastes come into the stomach more readily when you apply oil first and then apply the heat. Is this clear? Okay, so this is the reason why. So once it all comes into the Koshta, then we can remove them by the procedures of cleansing. So this is the rationale behind the preparatory procedures in biocleansing. So now let us look at Snehana, or the process of oiling the system. And as I mentioned, in Ayurveda we apply oil both from inside as well as from the outside. So Snehana is actually a process through which the body is saturated with fat. And when this happens, the metabolic wastes loosen up, and then they can be easily separated. And the simplest method of oleation is just the application of oil, which is an external procedure. So when you talk about Snehana, we are talking about very simple procedures like application of oil on the body. And we are also talking about very complex methods and procedures like internal consumption of ghee. Patients are asked to drink ghee and drink them in really very large quantity. And these quantities can be as high as 450 ml or even 500 ml, sometimes even slightly more. So you can just imagine it's like drinking a bottle of water. So you can imagine that this process is called in Ayurveda as Snehapana, which means drinking fat. So just like you drink a bottle of beer or a bottle of water or a bottle of juice. So when you're undergoing this procedure in Ayurveda, you have to drink a whole pitcher of ghee in one go. So half a kilo of ghee is just swallowed. And this whole process of Snehapana can last for up to 7 days. So you start with a small dose, and then you increase it, day by day till we reach the maximum dose. And so this is an elaborate procedure. And on the day of doing Snehapana, we will not eat any other food. It's taken on empty stomach in the morning. And then you can have some light food like the rice gruel only after all the ghee that you have consumed has become digested. And when you begin to get hunger, that's when you have your first meal. And this is a bit challenging for the patient because as the treatment progresses, one of the problems with Snehapana is that it will greatly increase the appetite of the patient. And so most of the people who do this will find it really difficult to be able to control their hunger. So is this clear? So this is Snehana or oleation. Yes, there are. So when I am coming to the individual procedures, I will be listing the people in whom we can do a particular procedure and the people in whom we cannot do a particular procedure. So we will look into that, when we start discussing on each individual procedures. But I hope this overall protocol is clear as to how this is done. Okay, so here it is. We are starting with the first of the procedures. So with this, we are completing our introduction. This is the overall principle, the framework of the whole process of treatment. And now we will look at a few specific procedures. And I'll just be back in a moment. I just need to go to the washroom. Just a moment. I'm sorry for that short interruption. So now we are going to look at the first procedure. So the first procedure is oil application. And I want to distinguish between oil application and massage. They are both different. And Abhyanga is actually just oil application. It's not really massage. Because in Ayurveda, there are different types of massages. So some massages are very strong. They're very powerful massages. And these are called as Mardana. And then there is very gentle massage, which is called as Samvahana. So there are other terms for massage, and oiling as such is not to be confused with massage. So now let us look at what is the definition of oil application. We look at the overall procedures of how this is implemented. And although it's a very simple procedure, as we discuss, we will realize that we have to be really very careful when administering this therapy to be able to get the expected results. So if you ask what is Abhyanga or oil application, then we can say that it is an Ayurvedic therapeutic procedure in which oil is applied with one hand on the whole body, and the patient is made to lie in specific positions. This is basically to ensure that the entire body, is applied with oil. So you have the supine position, the pronate position, the left lateral position, the right lateral position. So all these positions, the patient is made to lie in all these positions. And then the oil is applied so that it is evenly spread throughout the surface of the body. Now, here are every procedure in Ayurveda, there are indications and contraindications, which means they can be applied in some individuals and they cannot be applied in some other individuals. So, first of all, Abhyanga is indicated in a person who has a dominance of Vata. And it is also indicated in patients who have bodies that become extremely dry and there is a need for supplementation of fat. So in such individuals also we can do Abhyanga. It's recommended, generally this is one of the simplest procedures to oil the body, and so it can be implemented in all seasons and for patients after taking the necessary precautions. So, but for normal individuals, what Ayurveda says is that you can apply the oil every day, there's no harm. Unless the climate is really very erratic and you may get exposed to etiological factors that can trigger. So contraindication is in people for whom oiling and fermentation are not indicated. This is basically people with dominance of Kapha, Pitta and Rakta. So in such people, if you do too much of oiling and intake or external, it can lead to imbalances. So it's not allowed in these individuals. And a very, very important principle is that oil application should never be done when there is indigestion or when there is accumulation of harm. So if you follow this one single principle, then we can avoid a lot of unwanted effects that may come from oil application. So when we are recommending oil massage or an application, we have to tell the patient that you can do this only on an empty stomach. This is really very, very important. I hope you know that 70% of the body's resources approximately are used for digestion. Digestion is one of the activities of the body which is very energy demanding. And so, if your body is busy with digestion after taking a heavy meal, then we should never, apply oil in that condition where there is indigestion. If there is indigestion and if you apply oil, then so many problems can arise that even running nose, headaches, increase in body heat, aggravation of the disease, all this happens while in the wrong context. So people with poor digestion, you have to do this on empty stomach. So their digestive systems shouldn't be active when you're doing Abhyanga. Plus, you can also give some digestive herbs. and prepare them. So if you give digestive herbs and prepare them for Abhyanga, you make sure that they had a meal which is digested and you're not doing Abhyanga immediately after a meal, then we can avoid problems. So the problem of mild indigestion can be overcome by using herbs, but there's no way we can compensate for a heavy meal. Like if you have taken a heavy meal, then absolutely no Abhyanga. So you must tell your patient not to drink juices, not to come, on a full stomach, even if it's liquids or briskets, or you have to. So for certain surgical procedures, they would say you need 8 hours of fasting. So for Abhyanga, you need at least 3 to 4 hours of fasting, maybe even more if your meal is really very heavy. So this thumb rule has to be really kept in mind. The patients have to be sensitized. Is this clear? So these are the indications and contraindications for oil application. So here we can never do things according to the convenience of the patient. And this is one of the most violated rules in Ayurveda. A lot of people give Abhyanga without taking into consideration these subtle points. So this is a picture of the methods of oil application, and as I told you, I have not discussed about massage. Massage and yes, you can combine it with aromatherapy, but you need to have a clear logic. Uh, Oil in Ayurveda is basically working against vata. And so you can enhance the properties of the oil by combining it with certain aromatic substances. But your overall treatment plan should be very, very specifically laid out, or else you might end up not using the right substance, might create imbalances. But definitely, I don't see any problem in combining the two. So the bottom line of what we discussed so far is that massage is not what we call as Abhyanga. Abhyanga is something very, very different in the sense that it's just application of oil. And massage, as I told, is of two types, the soft massage and the more strong massage, and both of them require more specialized training, and their purposes are also different, and so we will not discuss about them in a webinar. It requires a lot more practical training and exposure. So now let's look more into the massage and how the preparation of the patient. So the preparation of the patient means, as I said, the digestion of the food consumed the previous day should be ensured. We have to ask the patient whether their bowels are clear. And we have to empty bowels and the bladder before the treatment starts. So you must tell the patient to go and clear his bowels and bladder before the treatment. The treatment should never be done by suppressing the natural urges, or the patient shouldn't feel, in the middle of the treatment to go and attend to the natural urges. That will affect the quality of the treatment. So it's also a principle in Ayurveda that the best time to apply oil is when the hunger begins to manifest. So Ayurveda says that you can wait till you begin to sense that feeling of hunger, and at that point you can start the procedure of oil application. And in our Indian tradition, we always light a lamp because we consider the process to be very sacred. And the lamp, as we know, represents knowledge. And so the idea is that lighting the lamp gives it both a feeling of sacredness. In Ayurveda, treatment means actually worshipping the patient, the healing power inside the patient. And so to symbolize all these things, we have the procedure for lighting an oil lamp before the treatment starts. Now, if you were to ask which are the ideal timings, so in a country like India where the weather is quite warm, we have to do this between 6 a.m. and 4 p.m. And if you are planning to do an abhyanga in the evening, then your last meal should be taken at 10 a.m. And very mild liquids, if the patient is really weak, may be given 2 hours before the treatment plan. So these are some of the points to be considered when you're preparing for oil application. As you can see, the status of your digestive system is actually the most crucial thing here. So is this clear? Any questions? Okay, so if it's clear, we will continue. Now, how do we prepare the place for doing abhyanga? You need materials. You need a vessel to keep the whole quantity of oil. You need one big vessel to boil water. These are all the settings that are required when you do abhyanga in a classical manner. As described in the classical text and as practiced by the traditional physicians. So you have to keep the oil in a special vessel and keep another big vessel to pour the collected oil. And 2 small vessels are always kept with sufficient quantity of oil for application on the patient's body. And then, of course, we need a stove. We need to tie a cloth strip around the patient's head. And then herbal bath powder is given to remove the oil. So if you want to do one sitting of abhyanga oil application, then typically you would need at least 200 ml of the oil to cover the whole body. And so this is what you must be ready with. And for the head, you will need only 15 ml. And then we need certain herbal powders. I don't know if you've heard Rasnadi Churnam. It is a herbal powder. Because one of the biggest problems that will happen when you do oil application, especially if it is not done properly, is that it can trigger, allergic reactions, sneezing, and symptoms of cold, and even fever. There's a special herbal powder which is kept. I don't know whether you're aware of this practice. So after you do abhyanga, and if you have an oil bath, and especially for the head, then you have to take a pinch of this powder. A pinch of this powder is to be taken and rubbed vigorously in the center of the head. And this powder is what is called as Rasnadi Churna. Does anybody know about this powder, or do you have the practice of rubbing the powder in the center of your head after you have an oil bath? Okay, this is really very important. And if you do this, then you can prevent a lot of unwanted effects, especially in people who are not so much used to, applying oil. You can prevent them from getting cold or headaches or nasal, blocks. So you can try to see if you can get Rasnadi Churnam in your country. This will not be much of a problem because it's only for external use and also just for rubbing on the head. And I don't think any modern doctor would be much worried about what will happen if you rub this powder in the middle of your head. I mean, I'm sure they will mind. I see. Yes. Some herbs, the name of the plant is Alpinia galanga, and there are many other herbs also. So is this clear? So please make a note of this powder, which should be then applied on the head after the bath. And it will actually it will make your scalp dry very quickly. It will prevent the moisture from, seeping into the body cavities of the scrotus and causing blockage. So this is the way you have to prepare. Yes, only on the center of the head. There is a marma there. So it's also the place, it's a place on the head where the sutures of the skull meet. So that is where you have to apply this powder. And actually it is the place, which is where the bones, so it's called as the anterior. It is the place in which the bones are not joined together in, young children. I hope you know that when we are very young as babies, in our scalp, in the top of our head, there is a depression. Are you aware of that? So when we are old, of course, the depression closes. But yes, exactly. So that is the point where this powder has to be applied. And we don't need too much of quantity, the 2 or 3 pinches of the powder there, and rub vigorously with the palm of your hand. So you have to rub that point vigorously with the palm of your hand. And that is how this powder has to be applied. And if you apply this powder like this, then it helps to prevent the complications of Abhyanga. I don't know if you have experienced, I have seen a lot of patients, when you ask them to apply oil on the head, many of them get problems. They're not very serious problems, but they can be very annoying. People come back talking about headache. Sometimes they have bouts of sneezing, and some people get very severe nasal congestion, and some people get pain in the ear. All these things can happen when you apply oil and take head bath. And for that reason, for children, we do not recommend, certain types of oils. There are special oils which are applied in children. And also another thing is, if you start applying the oil right from childhood, then the body gets accustomed to this. And then when you are older, there's not much problem. But in today's society, people do not have the habit of applying oil regularly. So suddenly one day when they do this, they get all these unwanted effects. And that's why in Ayurveda these precautions are mentioned. So that's about preparation. This is how we must keep the place for the oil massage ready with all the necessary items that we have and we would need. Now comes the procedure. So I'm sorry, this slide is quite busy. Are you able to read it? You might need a pair of glasses, which even I think I need to be able to read this. I'm sorry for this slide. We could have actually split it into 2 slides. Are you able to read the slide? Anyway, I will read it out, and maybe when you get the file, you can, split this into 2 slides. Are we able to see the slide? Okay. So, there are some procedures and sequences where you must start the application of the oil. So in Ayurveda, we say we start on the head, then the ears, and then the feet. So that's a sequence. First in the center of the head. Then in the ears. The trick for applying oil in the ears. One is that you can put the drops inside the ears, or you can just apply oil in and around the ears, and just below the ears you apply the oil and give gentle massage. There is a marma there called Vidhura marma, and that marma is massaged mildly when you apply the oil there. And the third place where you apply is the feet. So this is to make sure that when you apply oil, there is a redistribution of the heat in the nerves, and these are the connecting points. If you apply in these places, we know that these are all the places which we protect when we go out. We use a muffler to cover our ears and the center of the head, and we use shoes to protect our feet. If these portions are not exposed, then you will not get affected by the weather. So that's the same principle. And then the next is the palms. So we know if our hands are exposed openly, then we are affected by the cold. And then we have finally the umbilicus. Yes, this is only the first steps. First, you have to apply in these 5 locations. In fact, if you apply oil to the head alone, that is not good. At least you must apply to the 5 locations. So if you are in a hurry and you don't have time for a whole body bath, whole body application. So you should, if you apply at least to these 5 locations, then it's as good as you did a mini abhyanga for the whole body. And that's the important thing. But if you just apply only on the head, then it can affect the heat distribution. And also applying oil only on the body and not the head can actually transmit all the heat to your head region. The heat will come up to your head region, and this is also not good. This is clear. So this is very, very important, that a very quick method of applying oil is on the ears, the feet, the palms, and the umbilicus. And a strip of cloth is to be tied on the forehead of the patient above the eyebrows. This is basically to ensure that the oil doesn't go into the eyes. Some of the oils are, irritating, and so they can cause irritation in the eyes, and that is why we have to tie a thread. And if you apply the oil only on the body and not the head, then that's also harmful. So ideally, you need at least 2 people to do the application, because you can symmetrically, it's not possible for one to cover the whole body. And when you apply on one side, the other side will be cold. So to prevent this, if 2 people simultaneously apply from both sides, then you can do it in a rhythmic and balanced manner. An oil application should be started in the sitting position. So after the 5 locations are finished, then we start from the back, the lumbosacral joints, then the upper back and upper limbs, and then the patient is moved from sitting position to a supine position, and then the umbilicus is applied in a circular motion and in a clockwise direction, then the lower abdomen, and then the lower limbs, and then it is applied in the chest and arms, and oil is to be applied in anti-clockwise circular motion on the right side of the chest and clockwise on the left side. It should be applied in downward movement, strokes on the anterior, medial and lateral aspects of the upper limbs. So there are very specific guidelines on how oil has to be applied. So the positions are kept changing one by one. And oil is applied in changing positions to ensure that all the parts of the body are covered, and the oil is completely reaching all the portions of the body. So we start in a sitting position and then also end in a sitting position. So there are 7 positions in which the oil has to be applied. And then the patient is made to lie down for a particular period of time. So this is the most important thing, that after application of oil, we need to make the patient to remain in that position for a certain period. And that period is very crucial to stimulate. It is during that period that actually the body the heat will be trapped inside, sweating will be induced. So if you ask how long you must lie down with the oil on your body, then we would say that you have to lie down like that until you feel that the body is getting heated, and until you begin to feel the sweat coming out. So when these 2 things are achieved, you can be clear that now you have completed, the Abhyanga has worked correctly, and then you have to use herbal powder and remove the oil. Now this is very important, because when you apply oil, yeah, so if sweat doesn't come, the maximum time that we keep is for 45 minutes. So in some people who are Vata Kapha and who have too much of Kapha, or in the cold season, that is when you will not see much sweat coming. But otherwise it happens. And in people with Pitta constitution or Vata Pitta constitution, or in summer season, or in a place which is warm, sweating may happen very quickly. So you need to know the constitution of the patient, and then also certain oils. Yes, it is possible. We are talking about Abhyanga as a treatment procedure. Abhyanga as a self-care is discussed in preventive medicine. But now we have come to the section of therapeutics, therapies. That is why I talked about application by therapists. But for a healthy person, you can do this application yourself. There is no need of any therapist. But all these principles are still applicable. And you need to follow these sequences and these procedures. So, is that clear? So, can you hear me now? So we continue our webinar. Okay, so we were talking about Abhyanga, the procedure, and what are the precautions that we have to take when we do this. And so we discussed about how to apply the oil and the importance of the various locations, the sequence in which the oil has to be applied, and the positions in which the patient has to lie down to ensure that the whole body is covered. And then after the procedure, it's really important. Like in Ayurveda, what we say is that we keep the oil till the time that the body will absorb what is required. The excess oil should always be removed. So the excess oil has to be removed, because oil, if it remains on the body, then it will interfere with the heat loss mechanism, and it can cause imbalance. So this is a problem sometimes which happens, that after the treatment and the bath, if the oil has not been properly removed, then the oil remains for a longer period in the body, and this can interfere with the natural heat loss mechanisms. We know that the body loses heat by evaporation, by radiation, by convection, and conduction. These are the four methods through which heat is lost. And the oil remaining on the body will actually interfere with these natural processes. And therefore, that's why herbal powders are used. And the powders can be chosen depending on the sensitivity of the skin of the person. So if you have dry skin, then we use certain powders. If it's wet skin, you use different types of powders. But the most commonly used combination is green gram powder. And green gram powder is a little dry, so in order to prevent that, we use fenugreek seeds also mixed with green gram powder. This is a good combination for removing the excess oil from the body. During treatments in Ayurveda, we don't generally encourage the use of soap and other, shampoo, body shampoo. Is usually only herbal powders that are used. So then the bath is taken and the excess oil is removed, and that completes the procedure. So when you are undergoing a process of Abhyanga, because of the heat and the sweat, some of the wastes, the metabolic wastes in the body, will come to the alimentary tract. And so, A mild laxation, not a big purgation, a mild laxation is advised using some gentle herbs while the Abhyanga is being done. And this ensures that whatever wastes are precipitated by the treatment will be removed from the body then and there. So this is the cleansing procedure that we have to do after that is done. And now how do we know whether we have done this procedure properly? So, and whether we have, if we have made a mistake while we done that, so by observing some signs, we can understand whether our application was correct or not. So some of the desirable endpoints when we do oil application correctly, we can see that the dryness of the skin is considerably reduced. There is induction of sweat. There is good absorption of oil. There's a feeling of fullness. The fatigue is relieved. We will get very good sleep, and you can find that your body becomes more freely movable. And especially, muscle cramps, you get relief from such symptoms. Some of these outcomes are seen immediately, some are seen, a little later. Now, if the oil application was not correct, then you will find some other symptoms, like there will be heaviness of the body. So after a procedure of Abhyanga, if you are feeling very much heavy in the body, it's a clear indication that there is something wrong with the way it was applied. And then you may get headache, which also indicates that your procedure was not correct. And then you can get giddiness. And if you feel that there's a sensation of heat increasing in the body, there will be lacrimation. That means your eyes will continuously water, and then you begin to get symptoms like sneezing, there's nasal block, and then it means that these are undesirable effects. There's something wrong with the way you did the oil application. So using these symptoms, we can know also and judge whether our the way we did the procedure was correct or not. So this is really very important to observe these symptoms after doing the Abhyanga. And you have to make sure that the patient doesn't experience these symptoms after the massage has been done. So if it is seen, then we have to plan that the next day maybe identify the reason and the cause, and then think before we continue the treatment on the next day. Now there are some precautions. The oil shouldn't be too hot, and ideally it should be fairly warm, because a warm oil is absorbed better. So the warmth of the oil can be adjusted according to the sensitivity of the patient and its skin. So we have to actually do a test in the beginning of the heat, and then apply. And then the two therapists should synchronize their movements so that the oil is applied on the left and right part simultaneously. This is very important. The application should be similar on both sides. And then it's very important to make sure that the oil doesn't go into the eyes of the patient, and there should not be too much of pressure while applying the oil. It should be evenly applied. As I said, this is not massage, this is only application of oil. And it's also very important that the whole process is continuous and there's no interruption in between. I mean, you cannot apply the oil and leave the patient like that and then come back and then continue. So this is not allowed. And then the patient has to be comfortable in all positions, and we have to make sure that the patient is not in pain or discomfort while the oil application is done. So the whole process should be extremely comfortable. So some people can develop pain and discomfort as a result of the oil massage just because the position, uh, their position is not made comfortable. So people with back pain and such other musculoskeletal diseases, they have to be extremely cautious. So this is the procedure for oil application. Is this clear? So with this we have completed the procedure for oil application. You have any questions? Or so how many of you were already doing oil application on patients or on yourself? So were there any things that you were doing wrongly? So you can think about all this to make the necessary corrections in terms of the sequence of the application and the positions, the timing, the many things that we need to consider. So is this clear? Any questions? Can we go on to the next procedure now? The temperature should be actually room temperature. It should be medium. Of course, depending on the country where you are, you can there can be slight variations, but room temperature around 30 degrees Celsius is ideal. So it shouldn't be too cold. So Ayurveda, we wouldn't advise using air conditioner to chill the room. That's not advisable because air conditioning can cause the srotas or the channels to contract, and this will greatly affect the quality of the abhyanga. And if it is too hot, then the patient can get giddiness and other discomfort. So it's room temperature. And you can look at Pitta persons and Pitta persons in summer season. In summer, we have to lower the temperature a little more. And in Kapha people or Vata people, and in winter, we have to raise the temperature a bit. But it should be normally around room temperature. So is that clear? Any other questions regarding the Okay, so if it's all clear, then we go on to the next procedure. So can you see these pictures here? So this is the next method of oiling, and you can see that the oil is poured onto the patient's body. Whereas in oil application, we were just applying it with our hand. Here the oil is taken in a vessel and then poured onto the body. And here again you can see this is a procedure which we can never do ourselves, whereas the oil application is something which we can do auto application. But this procedure, this is called as Tailadhara, means flow of oil, or we can say oil irrigation of the body. Is this clear? This is different from the oil application. So now we will see which are the indications in which you can do this treatment, and then we will see all the procedures and the details. Have you seen this, or has anybody done this before? Okay. So then this should be interesting, yes. This is very good in improving microcirculation, and also very good in normalizing vata. So oil irrigation is sometimes called as snehadhara or tailadhara. This both mean the same. And if you look at the definition, it is an Ayurvedic therapeutic procedure in which oil is continuously poured from a vessel onto the whole body by keeping the body in specific positions. Now, this is indicated in Vatic or Vata dominant conditions. So very similar to the indications of those who need oil massage. So people who are going to be prepared for fermentation, people in whom we need to induce SNEHANA or oleation. And it can be done in all seasons for patients with necessary precautions. In normal individuals can be. So it's basically again in Vata or Vata dominant conditions. So it's more potent than simple oil application. So it's done in diseases. Sneha means fat. So it means pouring fats on the body. It can be oil, or it can be ghee, or many other fats are used. But what is most commonly used is oil. So that is why this is also sometimes called as Taila Dhara, and Taila means oil. So I could have, I don't know if there's a way to show videos, because it would have been even more nice to have shown some video clips. So maybe I will kind of check up and see if, yeah, we use marrow and then tallow. So these are also and sometimes we also use milk. That is oil. The same oil is most commonly used. Is it clear now? In Ayurveda, we do not use olive oil. So because it was not available. But I think olive oil may be used in specific conditions. But sesame oil is the best for vata. And sesame oil is available all over the world, so that has been considered as the most universal. Sesame oil is for vata and kapha. For kapha specifically, mustard oil is the best. So you know mustard oil? Yes, so in very cold climates, we can also add mustard oil to sesame oil, and then it becomes better. Coconut oil is used for skin. We have to study about olive oil, and I have never used this, so I need to study it to understand. But I think it's very similar, a little bit maybe similar to coconut oil. Olive oil maybe is a little bit more cooling. It may be good for pitta. Yes. So usually we use sesame oil, and so let's go into more details about the procedure. Are there any more questions, or can we continue? Okay. So here again, the preparation of the patient is very, very similar to that of oil application. So the digestion of the food consumed the previous day has to be ensured, and the bowels and bladder should be cleaned. In fact, when you are doing Taila Dhara, Abhyanga you can do even if there is mild indigestion. By fasting, by not taking food. But Taila Dhara cannot be done if there is indigestion. So we have to prepare the patient well to do Taila Dhara. It's not like even just simply application of oil. So we have to arouse a little bit of hunger, and then again, light an oil lamp before the treatment starts. It's like, the whole procedure becoming sacred and a matter of worship. And we have to do it in the mornings. You can do this after 6 a.m. and in the evening after 4 p.m. So the ideal time for conducting in a country like India, where the climate is warm, especially in South India, we do the treatments, these kind of treatments between 6 a.m. and 10 a.m. So treatments are not done after 10 a.m. No, it is not Abhyanga. It is done, when it is done, usually first Abhyanga is done and then Dhara. Abhyanga is very very specific. It's only application of oil, and pouring oil is called as dhara. So there are two different procedures. I mean, very clearly two different procedures. Okay, so when you are doing this procedure, your last meal should be at 10 a.m. if the treatment is done in the evening, and if you are doing it in the morning, then it has to be done on empty stomach. So this is really very crucial. So then we go on to the procedure as such. So here again, you know that the sequence of application of the oil is done. Then the oil strip of cloth should be tied above the forehead, and then oil is applied all over the body. So before doing this Taila Dhara, we do Abhyanga. So that's very fundamental. Abhyanga is a basic procedure, and for most of the treatment procedures that we are going to do, we will first have to do Abhyanga and then only do the procedure. So then the oil is poured into the small vessel. So we have, special vessels in which were used in Kerala. It's like what you can say. It's a vessel with a small, tube-like structure through which the oil can be poured. So these vessels are used, and the patient again is made to sit and lie down in all the 7 positions. And the distance between the oil and the body is 12 fingers length. 12 fingers of the patient. So the length of the 12 fingers length is that you keep 4 fingers and 4. So the 12 fingers length. From that distance the oil should be poured. And it should be poured always in a clockwise direction and only in a downward direction, not in an upward direction. This is really very important, because otherwise the movement of Vayu will go in the reverse direction, and you can see if you keep pouring the oil in upward direction, the patient will feel discomfort and feel stressed. So the oil is poured in a clockwise and downward direction, and as the oil is poured, somebody has to collect the oil that is flowing, and it has to be warmed, and then again it should be used. So here it's very important, when you are heating the oil for use, it should not be directly heated over fire. We have to heat a vessel and then pour the oil into the vessel. So by pouring the oil into a heated vessel, we are able to heat it, and then it is used. Is this clear? So these are some important precautions. No, the bathing is done after the procedure, not before. So this is done in the early morning, usually, or in the late evening. 2 times it is done. It's done before bath, and bath is usually taken after. So in case you find that the body of the patient has dirt or sweat, then you can wipe. Yes, this is a good question. The oil does collect some dirt from the patient's body. So now we are working on some filters. So technology is available today. Filters can be used to collect the oil. And so these dirt and other body substances can be eliminated. So we can just wipe the patient's body clean before doing the abhyanga. And of course, there's an exception, like if you find that the patient is really dirty and has a lot of, so especially in a place where it's very warm and humid, then you can have a mild bath and then do the procedure. But the thing is, the patient will have to again undergo bath after the treatment. So in chronic illnesses, it's not possible to make the patient bathe twice. So in such conditions, it's very difficult to make them, very stressful for them to have bath before and after the treatment. So in those cases, wiping the body clean with a moist cloth is actually preferred. Is this clear? Okay. So, yes, so today there are people who are trying to develop these filters and special equipments in which the recycled oil is cleared of all the dirt. And so we also recommend the use of such equipments which will make it actually more hygienic. So if you get the duration of this whole procedure, the maximum duration is about 90 minutes. It has to start with 45 minutes and then increase 7.5 minutes every day to make 90 minutes, on the 7th day, and thereafter 7.5 minutes is reduced every day to make 45 minutes to the 14th day. Or we can start with 60 minutes and increase 15 minutes every day. 90 minutes is the maximum, and then reduce it and end with again 60 minutes. So this is the sequence which is followed. Start with a lower time period, increase it, and then again kind of reduce it. So this is the duration of the actual whole treatment. This is also really very, very important. And just like when we did the abhyanga or the oil application, we gave a light laxative medicine. So this is the effect of all these oiling procedures. It brings all the dirt from the whole body and brings it into the alimentary tract, and then it can be eliminated and removed. So oil should be removed by bathing, again using the herbal bath powder, and all the principles that we discussed for abhyanga will apply here also. And with this, the procedure is coming to an end. The points of the Tailadhara is also very similar to that of abhyanga. It's almost a repetition, so we don't need to really discuss it. But some of the undesirable additional problems that we see is if the oil is not suitable for the patient, then what happens is there can be skin allergies. Sometimes seen, very rarely seen, skin allergies. portions of the skin will become red, or sometimes the patient begins to get an itch. There are eruptions all over. Are things also sometimes seen. Sometimes this can also be due to contamination of the oil due to lack of hygiene and cleanliness. If the same oil is used for the next day and the third day or the fourth day, and the oil becomes contaminated, and when you repeat it, you can find that patients may get some skin allergies. So there are two types of problems that we commonly see with oil application. One is cold-like symptoms. So we say these are the upper respiratory tract problems, and then we have skin problems. So these two types of problems are seen commonly when you apply or use oil. So next we go to, so is this clear? With this we have completed the oil irrigation method. Is this clear? Do you have any questions? Okay, so we go to the next procedure. So you can see here that instead of using a vessel, the therapist uses his hands, and this procedure is called as spiritual, which means actually squeezing the oil. So a cloth is taken and the cloth is dipped into the oil, and then using the thumb of the therapist, the cloth is squeezed, and then the oil begins to float through the thumb, and then it is poured on the body through the thumb. So this method is called as the cloth squeeze method. Has anybody heard this methodology? Have you ever seen this kind of procedure? No. So this is a variation of Tailadhara. And in Kerala, this is a very special treatment of Kerala. So here there is a more personalized, the oil, the therapist, there's an influence of the therapist on the patient, because the oil now comes with the prana of the therapist. The oil flows through his fingers, and so there's an effect of the prana of the therapist on the patient. So if you're a good therapist, and if you have good pranic healing energy, then if you use this method, you will have a much stronger impact on the patient. Do any one of you actually do these procedures? Okay, so this is actually for therapists, and also some physicians, of course, do it themselves. But it's good enough that if you understand what it is all about. So, if you look for the definition, this is oil irrigation by squeezing a cloth in which oil is continuously poured on to the patient's body by squeezing a cloth piece dipped in warm oil. So again, the patient is made to sit in all the 7 positions. And here again, the indications and contraindications for all these procedures are similar. So we don't need to discuss that. But I'm discussing 3 procedures of oil application on the body, each one of which is more potent than the other. So simple oil application is the mildest, Tailadhara or pouring the oil with a vessel is more mediocre potency, and squeezing with a cloth is the strongest. So depending on the severity of the disease and the more potency if you want, then you can choose the most appropriate therapeutic procedure. Now, if the patient is extremely weak, the problem with PHL is also that although in the long run it increases the body's energy, if you do PHL immediately on that day, you can feel very tired and fatigued. So this may not also be possible in patients who are extremely weak due to disease. So these three options we have to choose. And if Vata is more strong, then we can go for Pirichil or the cloth squeeze method. So the indications and contraindications are very similar. And except what we have to add here is if the patient is very weak, then we have to be careful about doing this procedure because they can become extremely fatigued and, may panic if they find that after the treatment they are more tired than usual. So here the preparation, even the location is very important. We need a very well ventilated room with good lighting, but there shouldn't be too much of crosswinds or direct sunlight. And the patient should be, the room should be pointing towards the east. So because in this procedure, more of the patient's prana is actually, stimulated. That is why the location is very important. We don't want any disturbances to the patient's prana while this treatment is done. That is why a well-ventilated space is not disturbed externally by the sunlight, the breeze is actually very much essential. Now, the other protocols are similar, that digestion of food has to be ensured, the bowels and bladder should be emptied, and in case the patient feels an urge while the treatment is being done, we should never force the patient to suppress his urge. Like if the patient feels like voiding the bowels or urine while the treatment is being done, then we have to definitely stop the treatment and allow the patient to actually go to the washroom and come back and then continue the treatment. So stoppage of treatment is allowed when there is an urge that comes. So suppressing an urge, natural urge, is considered to be extremely harmful. So then we have to arouse the hunger, and again, just like the Tailadhara, the cloth squeeze method should not be done when there is indigestion. So we have to make sure that the patient's hunger is active when the treatment is actually done. So just like the previous procedure, the timings are between 6 a.m. and 4 p.m. and the last meal to be taken at 10 a.m. if the treatment is going to be done in the evening. So this is standard. Now the problem with this cloth squeeze method is that this is very manpower demanding. So you need 4 therapists to actually do this. 2 have to sit on each side of the therapy table. And 4 people, sometimes even 6 people do it, so that the entire body is, immersed in the flow of oil. And that is what makes it actually very intense, and the patient will feel very tired after the whole program. So from 7 to 5 people are needed minimum So if there are 7 people, there will be 6 pouring the oil and 1 will be recycling the oil. If there are 5, then 4 will be squeezing the oil and 1 will be recycling it. And now the procedure is, again, a lot of things are similar, that you have to first do the abhyanga and apply the oil in the sequence, as we said, in the center of the head, and then the ears, and the feet, and the palms, and the umbilicus in the back. And then oil should be applied all over the body, and a strip of cloth should be tied on the forehead of the patient above the eyebrows. And then the cloth pieces are dipped in the oil, and again it's at a distance of 12 fingers from the body of the patient. And the cloth is dipped in the oil, then taken out and squeezed, and the oil drips over the thumb of the therapist onto the patient's body. So the thumb is pointed to the body of the patient. So that was shown in the picture that I showed a little earlier. So here, when we apply, as the oil is poured on the body, through the left hand, we gently, give a stroke on the patient's body. So gently move the left hand on the body and make the oil flow in the downward direction. So gentle strokes are given with the left hand while the oil is poured. So this is a very specific method used in the oil squeeze method. So again, the 7 positions are to be used, and the steps in an oil drip should be followed. The recycled oil is warmed and poured into a heated vessel, and as we mentioned earlier, the oil should not be directly warmed on fire directly. So these are all the other common procedures. So I hope the specific differences were appreciated for this procedure. The main challenge is that we need to have more people to do this, and it's more intense, and patient can feel very tired when this procedure is done. So here again, the same duration and cleansing principles follow for both the oil irrigation as well as the cloth squeeze method. The timing is maximum is 90 minutes. We can start with 45 minutes or 60 minutes. And on the last day, we end with 60 minutes of pouring the oil. You can see this is quite a laborious process. Nowadays, people are also using machines and equipments to actually do the oil pouring. But in ancient times, transmission of the prana, also of the healer, to the patient was considered important. So when a machine is doing this process, there's no transfer of prana. But today it's also quite difficult for one person to handle so many patients. So we may have to also use mechanical devices in the future. And today's physicians are also quite stressed, so they cannot afford to lose a lot of prana to the patient. So for all these reasons, spiritual is done in a different way nowadays. Now, laxative medicines are to be administered, and then oil should be removed by bathing using the herbal bath powder. These are all very common, just like in the previous procedure. And the endpoints are also very similar. And as I said, the undesirable side effect for spiritual is a much stronger, feeling of tiredness, which is more pronounced when you do spiritual than when you do oil application or just the dripping of the oil. So is this clear? So with this we have completed 3 procedures of oleation, or what otherwise we can say oiling the body. And these three procedures are by application of oil, pouring oil with a vessel, and squeezing oil with a cloth. So these three methods with intensity, varying intensity. So once these procedures are done, the body is now slowly saturated with oil. There are even more procedures for doing this. We will discuss that in the future webinars. But today my goal is to introduce you to the basic procedures of Snehana and Svedana. That is the basic procedures of oiling and fermentation. So when the body is saturated with oil, now the time comes for fermentation. So when you apply fermentation, which will induce sweating, so this is active sweating. Now we are going to apply heat on the body. Limited studies are done. So there's some study which showed that these oils are able to interfere with the inflammatory pathways. It improves, microcirculation. So some of the effects have been partially studied, but not many studies have been done. So now we are coming to the fermentation, where heat is applied. Heat is applied over the body to induce sweating. So you can see in the picture, this is called as Churna Pinda Sweda. Have you heard of this? Have you seen these cloth bags? So you can see these are cloth bags filled with herbal powders. Has anybody seen this before or done this before, or have you heard of this procedure? Okay, so that's good. So you need some training to be able to make, okay, yes, so this is Ayurvedic. So the cloth is taken and then the herbal powders are put inside, and the cloth is tied to make it into a round globus-like shape. Then it is tied, so you can see that in the picture here. And this is heated, and then, okay, sand is sometimes used, but that's different. That's called as Valuka Sweda. Its effect is different. Valuka means sand, but here it's called as Churna Pinda. Churna means powder, and Pinda means, a bolus. So it's a powder bolus fermentation, if you want a very specific translation. So in this, as you can see from the they are dry. But they are dipped in oil. This whole, the powder is dipped in heated oil and then applied on the body of the patient. So this round bolus, what we do is we take some oil, and this oil is heated directly on fire, and then this bolus is dipped in that hot oil, and this has to be done very, very carefully. So it has to be applied very, very carefully, because this bolus will be very hot, and you have to just put it on the patient's body and immediately take it out. Inexperienced therapists can actually burn the patient's skin. So inexperienced, the heat, so we saw that in the previous treatments, the oil was tolerably warm, but here the heat is very strong. So this type of application is very good in muscle spasm. So, in people who have low backache with very tight muscles, in diseases where there is rigidity, this will easily loosen up the muscles, and the heat, it's deep heat. You can say this is deep heat therapy. But instead of just the heat, also the properties of the herbs will work on the patient. And so that's it. So let's now look into the details of this Churna Pinda Sveda. So this is an Ayurvedic therapeutic procedure in which heat is applied on the whole body in specific positions with a cloth sack filled with medicinal powder. So this is given in Vata or Vata dominant conditions where some drying is needed. It's also given in individuals which have some dominance of Kapha. So we can say this is useful in Vata and Vata Kapha and Kapha conditions. This cannot be used in Pitta conditions. It's totally contraindicated. So if there is people who have more Pitta and their recta or blood is also affected, then this cannot be used. And the general principle of there being indigestion and accumulation of ama, it's not Anna, there's a mistake in my spelling. So when there is indigestion, also this cannot be used. So we go on to the preparation. So here again it's very similar to both for Snehana and Svedana. This is very similar. So we have to prepare the patient, make sure that his bowels are cleared and the food that is taken the previous day has been properly digested. All these things are very common for all the procedures. And another thing here is that this procedure cannot be done when the climate is very hot. So this is usually avoided in summers. And also it's difficult to do when the sun has come up. So So it should be done a little early in the morning or late in the evening. In Ayurveda, no treatment procedure is done before or after sunset. This is a very important principle. No treatment procedure is done before sunset or after sunset. And no treatment procedure except a certain type of vasti, which we will learn later, is given on empty stomach. Is always given on empty stomach. People are not allowed to eat and come for any of these procedures. Now let's look at the procedure, how this is done. So a strip of cloth is tied on the forehead above the eyebrows. The physician or main therapist is again applying oil on head, ears and feet. Oil is applied all over the body and the patient is to be in the sitting position first. And now the cloth sack is dipped in heated oil and gently applied, at bearable warmth. So the thing is that you have to just, use the cloth bag, apply it on the body and take it off immediately. If you keep it longer, then there is burning of the skin. So the whole trick is in just, applying it on the skin, taking immediately, and again applying and taking immediately. And then as the heat of the cloth bag is lost, then we again dip it in oil and we wipe the oil out, because if the oil drops are there and if the oil drops fall onto the skin of the patient, then those areas can also get burned. So in order to avoid that, after dipping in the oil, the excess oil that drips from that bolus is wiped clean. And so that's how it is done. So then the cloth sack is applied on the upper back and upper limbs, and both hands touch the knees. The cloth sack should now be applied on the chest, stretched arms and legs below the knees. The patient should lie down in a supine position, and just like Abhyanga, the whole body is applied with this thing. Now the interesting thing here for this particular treatment is that you have two options. You can either use this in a local area or you can use it for the whole body. So both options are there. So if a person has only low back pain, and then you don't need to apply it on his whole body. You can also just apply oil in the low back region and then do the heating there. But usually even in such a situation, applying oil on the center of the head and on the feet, that is done as a routine to make sure that the heat distribution in the body is not disturbed. So this is the way Churna Pinda Sweda procedure is performed. So do you have any questions or doubts up to now? Is it clear? Okay, so if there are no questions, then we will continue. So here again we have described all the positions in which this is to be done, and then after the procedure is over, and especially after doing a fermentation procedure, we should never use cold water on the patient's body. That sudden change in temperature can cause really problems with the srodhas and circulation. So we should use lukewarm water after this procedure for bath. And this cloth sack can actually be used up to 3 days. but it depends on, if the cloth sack is getting spoiled or dirty, then you may have to replace it every day. But if it can be used carefully, then it's allowed to be used up to 3 days, after which we'll have to change it. Now the end points is that here again the dryness will be reduced, the sweat will be formed, the oil will have absorbed, and especially for Churna Pinda Sweda, you can find that the stiffness will be reduced. So reduction of stiffness is a very important endpoint when you do fermentation. Stiffness is considerably reduced. And the skin will become very soft after the sweating. And undesirable effects, apart from the general ones which I mentioned here, is of course the burns. That's the most unwanted side effect that can happen when you're doing this procedure. And this happens sometimes. People get skin eruptions. Redness of skin and such other problems. And then there can be aggravation of pitta. And also, if too much of heat is applied, the body gets overheated, then the patient can also complain loss of sleep. Is again an undesirable or unwanted effect. So these are some of the desirable and undesirable endpoints of Churna Pinda Sweda. The biggest danger when we are doing Churna Pinda Sweda is, of course, Pitta is to be considered the most. And the biggest problems happen due to imbalance of Pitta. Is this clear? Any questions? So that's clear. We continue. There's just one more procedure which we will discuss. So here are some special precautions that we have to follow. The cloth should not be too hot. The temperature should be checked with the therapist's hand. And in certain regions like the heart, the inguinal region, and the eyes, we should never apply too much of heat. The soft organs of the body. And if there are areas in the skin which is sensitive, then we shouldn't apply too much heat there. So for this procedure, 2 therapists are required, and they can do it, synchronize and do this. But if you are going to just do a local application just on the low back region, or just in the knee, or a specific part of the body, then you can even do it with one person. Self-application of this procedure is usually not possible because you cannot reach comfortably to all parts of the body to use this procedure. So it's also important to ensure that the process is continuous and uninterrupted, and too much of pressure, especially the cloth sac, shouldn't be pressed too much on to the patient's body. It shouldn't be kept there for more than a few seconds. If these precautions are taken, then there are no chances of any undue, unwanted effects being observed. So this is Churna Pinda Sweda. Is this clear? So we have just one more procedure to discuss today. So far, everything clear? Okay, so we go to the last procedure for today's discussion, and as you can see, this is another method of fermentation. So if Churna Pinda Sweda was, there are so many methods of doing fermentation and oleation, Snehana and Sweda. So in our webinar, it would be too elaborate to go into all these procedures. So we're just discussing some of the most important ones. And Churna Pinda Sweda is a more of a localized effect. And now we have what is called as Bashpa Sweda, or steam fermentation. And this is done for the whole body, and there are two types of equipments used for this. One is in the sitting position and the other is in the lying position. So you can see the picture of the two devices on the slide. So have you seen these equipments, or anybody has done this before? Has anybody done this before or seen this before? Okay, this is a bit similar. So let's go into the details of this procedure now. So the steam bath, okay, you have done it, yes. So here in Ayurveda, we use specific herbs to generate the steam in the oil, and this will be changed according to the needs of the patient. So it's not just plain water. That's the important thing. It's actually steam generated by boiling herbs in water. So this is an Ayurvedic therapeutic procedure in which sweating is induced with the help of steam. And so this is again indicated in Vata or Vata dominant conditions, people who need Sweda. And again, this is not just like all the Swedas. People who have Pitta or Rekta, this is not advised. But compared to the previous method called Churna Pinda Sweda, this is comparatively little mild. So the steam fermentation is better tolerated by Pitta persons compared to Churna Pinda Sweda, which will be more difficult for a Pitta person to tolerate. So these are the indications and contraindications, and as you can see, these are quite similar for most of the procedures. And the preparation is also very similar, the timings are very similar. So all the Snehana and Svedana procedures, the preparations are very similar. So once again, digestion and all those things are important, but the difference is when you do oiling, the chances of digestion and hunger increasing is a little less compared to fermentation. Because when you do fermentation, digestion and hunger increases sharply and strongly. So after the fermentation procedures, there will be more body heat, more appetite, and that's one difference between the two procedures. Now here in the steam bath also, this is important, that first we apply oil also before steam bath. So you can see in all these procedures today, application of oil was the first step. Because that's really a common procedure. It's the first step in all Ayurvedic procedures. So even in the remaining other procedures that we will explore in the future webinars, you can find that this is the same situation. So now if we are going to look at the procedures, the physician or the main therapist is applying the oil on the head, and a strip of cloth is tied on the forehead above the eyebrows, and then the oil is applied all over the body, and then the patient is made to sit in a steam chamber or made to lie down in a steam chamber. So two options are there. So depending on the ambulation of the patient, its condition, we can decide which equipment the patient has to undergo this procedure. After proper sweating has been induced, the patient should be taken out of the chamber and the sweat should be wiped off. The oil should be removed using herbal bath powder, and the patient should bathe in hot water and the oil should be completely removed. So this is the whole process. So here the patient is exposed to steam up to the point that sweating happens, and when there is profuse sweating, the patient is taken out. So if it is prolonged too much, then again giddiness and heat can increase to a critical level, and that is not actually allowed. So you have to make sure that the patient, this steaming is stopped. And the real difference in the effect of the steaming procedure, it's not plain steam, as I said, it's in the choice of the herbs that are added to the water to boil and generate the stream. So castor leaves, and then Vitex negundo is a plant. These are leaves that are commonly used to generate the steam. So when these herbs are added to the water and when they generate the steam, the effects are very different in different patients and in different diseases. So castor leaf is very good for muscle spasm and vata conditions, and the Vitex negundo leaf is very specifically useful in sciatica. There's also neurological pain. So in that way, the steaming methods are highly varied and specialized from patient to patient. So the duration is that it's not specified in time, but we have to continue the process of steaming until the patient is sweating and feeling lightness. But we should stop it before he feels extreme tiredness, fatigue, and giddiness. If any of these symptoms come, then we must immediately stop the procedure. Then the laxative medicine, the laxative decoction should be administered early in the morning, just before the treatment or immediately after the treatment, and this would depend on the condition of the patient. And the bath, again, the oil should be completely removed after by bathing and after breathing it. And the steam bath, these are the common good endpoints. Like again, the dryness is reduced, the skin becomes very soft and smooth, and there's good sleep and lightness. All these are good procedures. Again, the chance of burning is there because of the steam, and then the heat increase can be a problem. But there are other undesirable side effects for steam bath, which we can see in vulnerable patients, is the patient can have great thirst. And thirst can also go into dehydration. So we have to be very careful with patients who may be susceptible to get dehydration. In such patients, we have to be careful when we do this. Some people can develop post, steam application, they can develop shivering because the body is trying to compensate for the lost heat, and the patient can go into shivering. So especially in weak patients and patients who are suffering from chronic diseases, we have to be careful. There can be dryness of mouth, there can be heaviness of the body and headache and giddiness. heat sensation, and these are other common problems which we see with the other procedures also. So these are the desirable and undesirable endpoints. And then the precautions. There are simple precautions that the patient should be comfortable in the steam chamber, shouldn't feel any suffocation. And sometimes what happens is the steam condenses and drips as hot water. So if instead of the steam, hot water falls on the patient's skin, you can imagine what happens. I mean, it will immediately cause burning of the skin. So this has to be avoided. And if there are any signs of dehydration, then we must give warm water with little salt and sugar, and this can prevent dehydration of the patient. And so with that, we are coming to the end of today's webinar. And we discussed two major procedures of oiling and fermentation. 5 procedures were discussed. The overall rationale behind the Ayurvedic methods were discussed. So when we do these procedures, then all the metabolic byproducts are mobilized, they are precipitated, they separate from the tissues, and they come into the alimentary tract. And once we are sure that they have come to the alimentary tract, then by using the methods of Pancakarma, they can be removed from the body. So, do you have any questions? Or otherwise, we have come to the end of the webinar today.